So we are here this morning at Methodist Mansfield Medical Center, and we are with a very wonderful doctor. I'm going to let you introduce yourself. February is all about the heart, and so we thought an appropriate topic would be COVID and the heart. So I'm going to let you introduce yourself, and then we'll get started.
Good morning. My name is Arash Manzori. I'm a cardiologist, clinical cardiologist at Methodist Mansfield Medical Center. And I'm honored that I've been asked to do this and share my limited experience with you in terms of COVID-19 and its sequelae. As you know, this is a brand new disease. It's been around for probably a year, at least clinically. It's devastated the world, our country as well. As a result, we have very limited information on what it does, just to be honest with you. Now, I do have a paper that I've shared with our colleague. It's the latest paper in American College of Cardiology about the experiences and the findings, cardiac findings. But I can share with you some of my experiences.
We would like that.
Pretty much, just to distill it down, I'm going to give you a little background on the disease, of course. Coronavirus, COVID-19, it's what it does, it binds. There is a protein on the coating called the S protein. And what it does, it binds on this receptor called ACE2 receptor. Now, this receptor can be found, it is found on pretty much all the organs, but mainly the heart, kidney, liver, lungs, as well as brain and other organs. And that ACE2, it's involved in regulation of blood pressure, inflammation, vasoconstriction, oxidation, and multiple things. And the proposed mechanism is that coronavirus, COVID-19, exerts its effect through this particular mechanism. It involves creating thrombi, clotting. It's a major clotter, causes small microthrombi in the lungs, pulmonary embolisms, causes small thrombi in the heart, of course, and that's a mechanism of heart attack. It can cause inflammation of the heart, inflammation of the heart muscle, we call myocarditis, inflammation of the area around the heart, pericarditis, and pretty much it can cause anything. Initially, most of the patients initial presentation is obviously, the respiratory presentation, they're not breathing, oxygen level is low. We note increased cardiac enzymes, cardiac markers like troponin and CPK in the blood, and that's the first indication that there is something going on with the heart. Now, that by itself can occur with sepsis, with infection. So it's non-specific. It's non-specific. So what we do, we follow that test with obviously clinical exam. We want to make sure if there are any evidence of heart failure, and then we follow that with an echocardiogram to evaluate the muscle of the heart, the function of the heart, and we determine whether the heart muscle is affected. If we have a condition called cardiomyopathy or myocarditis, which is inflammation of the heart muscle, and of course it can lead to what we call congestive heart failure. And of course the treatment is just like, we just supportive, treat the underlying cause, and there are others who are better qualified to talk about the treatment of COVID-19. Of course, we've got remdesivir, we've got antibiotics, we've got respiratory kind of oxygen and whatnot. And so we do the basics and we treat heart failure if in fact there is evidence of heart failure with diuretics and the proper treatments. And of course, if there's evidence of blood clotting, we include blood thinners, and that's actually, we do blood thinners in most of the patients with COVID because there's heightened clotting. So that's basically the gist of it. And I have a paper here that I would like to share with you. It came out about 4 days ago, American College of Cardiology. It explains all of this. So I don't know if there are any questions that you have. I don't know if I could answer.
Well, I have a question. So does COVID always affect the heart in every patient, or is
No,
it?
it does not.
Okay.
It does not. In many patients, it doesn't even affect the heart. It's a very peculiar virus. We have patients who are, elderly patients with many risk factors. They come in, they just have a mild case of the virus, or they get treated, or they don't even get treated. They stay at home and they recover. And I've had past few weeks, I've had a few youngsters in their 20s, 20s, developing 20s and 30s, actually, one of them developed pretty bad heart failure, and we had to treat it. And so it's very peculiar. Otherwise healthy young individuals can have serious complications from this, whereas folk with multiple risk factors and predispositions do well. So it's a brand new disease. It's been around for not even 1 year, at least in our realm. So we are learning. It's been a learning process for everybody.
Is there anything specific that someone would, are they going to know that there's something going on with their heart? Or, what do you do? How do you know? Do you go to the doctor or not go to the doctor?
Well, it's you just follow the basic rules. If you get chest discomfort, pressure in the chest, heaviness in the chest, symptoms of a heart attack, let's say, or shortness of breath, that's terrible. You are unable to lay flat, let's say, very short of breath, lower extremity swelling, chest discomfort, chest pressure at the risk of redundancy, that's when he wants to really seek help.
Is there any signs of damage after the virus leaves the body, or once you've conquered it?
We only have about 1 year data. So there are patients who've actually had, who've had residual injury. I've seen a few patients, but then I've seen a few patients who've recovered spontaneously within days with no residual symptoms or even objective signs. Patients we've rechecked their echocardiograms and their heart function has recovered fully. Yes, and there are folks who are still on oxygen, young folk who are still on oxygen because of lung injury. And so I don't know the answer to that question.
Yeah.
We don't have, we just need to wait a few years to find out.
Yeah, unfortunately, right. So is there, and I know this is probably another question that there's not an answer to, but the mind wants to try to figure it out. And so is there some sort of underlying genetic factor or something? Have they discovered anything that?
I don't know if they have. I'm sure they're working on it, but I'm not privy to that. I haven't read much about it. I haven't heard much about it.
Yeah.
But I'm sure we will have, over the next few years, we will have a lot of research. And I suspect that this pandemic will change medicine, just as the HIV phenomenon in the 1980s, and I was going through school in the early 90s, how that changed the world of immunology. We really didn't have immunology before that for all practical purposes. Molecular biology and immunology, that changed it. And I think we can look upon this as a challenge that will help us learn more about the human body.
Yeah, I think it's going to change everything everywhere. It already has. One last question for you. What would be your advice to anybody out there when it comes to this?
Well, first of all, my advice is just social distancing and wear a mask, please. Absolutely wear a mask. Yes. And of course, most importantly, get vaccinated. And I've been vaccinated. Most of the people in this room have been vaccinated. It is very important to get vaccinated. It's a privilege. In many countries, and I can tell you, when I have relatives in other countries, they do not have that option. And they are willing to pay to go overseas to get vaccinated. So it's, and I hope this will be available for the general public soon, and we can get everybody vaccinated. But until then, and even after then, I really urge you to wear a mask and socially distance, and be sensible, use common sense.
Excellent. Thank you so much. We appreciate it.
Thank you.